Imagine sitting across from someone you love, and for a moment, something feels off. They smile at you, but it's not the same smile. Not because they've changed, but because in that moment, they don't fully recognize who you are. The memories you shared, the conversations, the years, slowly fading, not all at once, not dramatically, but quietly, piece by piece. For over 55 million people worldwide, this isn't a rare moment. It's daily life. This is Alzheimer's disease, a condition that doesn't just affect memory, but slowly reshapes how a person thinks, feels, and experiences the world. In this video, we'll explore what Alzheimer's really is, what's happening inside the brain, the early warning signs, treatment options, prevention, and how families can support someone through one of the most emotionally complex diseases of our time. What is Alzheimer's disease? Let's start with something important. Alzheimer's is not a normal part of aging. Everyone forgets things sometimes. Where you left your keys while you walked into a room. That's normal, but Alzheimer's is different. It's a progressive neurodegenerative disease, which means it slowly damages and destroys brain cells over time. It is also the most common cause of dementia, accounting for about 60 to 80% of cases. But Alzheimer's itself is a specific disease, with a specific biological process. And that process often begins years, sometimes decades before symptoms appear, which means by the time memory problems become noticeable, the brain has already been changing for a long time. What happens inside the brain? Inside the brain of someone with Alzheimer's, two abnormal proteins build up, amyloid beta and tau. Amyloid beta forms sticky clumps called plaques. These plaques build up between brain cells and interfere with communication. Imagine trying to send a message through a network that's slowly being blocked. Signals become weaker, slower, and eventually lost. Tau protein behaves differently. It forms twisted fibers inside brain cells, called neurofibrillary tangles. These tangles disrupt the internal structure of neurons. The cell can no longer maintain itself, and eventually it dies. As more and more cells are damaged, the brain begins to shrink. This is called brain atrophy. And one of the first areas affected is the hippocampus, the part of the brain responsible for forming new memories. That's why early Alzheimer's often looks like forgetfulness. But as the disease progresses, it spreads to areas responsible for language reasoning, behavior, and even movement. Which is why Alzheimer's becomes more severe over time. Early signs and symptoms. One of the most difficult parts of Alzheimer's is how quietly it begins. The early signs are often subtle, easy to dismiss, easy to explain away, but they follow patterns. Here are some of the most important warning signs. Memory loss that disrupts daily life. Not just forgetting, repeating the same questions, forgetting recent events, relying heavily on reminders. Difficulty planning or solving problems. Tasks that once felt simple, like following a recipe or managing finances, become confusing. Trouble completing familiar tasks, getting lost on a familiar route, or forgetting how to operate everyday tools. Confusion with time or place, losing track of dates, seasons, or where they are. Problems with words and communication, struggling to find the right words, stopping mid-sentence, or calling objects by the wrong name. Poor judgment, making unusual financial decisions, or neglecting personal care, changes in mood and personality. Increased anxiety, suspicion, irritability, or depression. And here's something important. These symptoms don't appear all at once. They develop slowly, which is why early detection can be so difficult. Stages of Alzheimer's. Alzheimer's progresses in stages, and understanding these stages helps explain how the disease evolves. Early stage, mild. Memory lapses. Begin difficulty with organization and planning. Subtle personality changes. Many people can still live independently at this stage. Middle stage, moderate. Symptoms become more noticeable. Confusion increases. Communication becomes more difficult. Behavioral changes appear. People may need help with daily activities. Late stage, severe. The disease significantly affects physical function. Loss of speech, loss of mobility, inability to recognize loved ones. At this stage, full-time care is usually required. Treatment, medical options. Now, let's address the biggest question. Is there a cure? Currently, there is no cure for Alzheimer's, but there are treatments that can help manage symptoms and slow progression. The most commonly used medications are cholinesterase inhibitors. These include donepezil, rivastigmine, and galantamine. They work by increasing levels of acetylcholine, a chemical important for memory and learning. For moderate to severe Alzheimer's, memantine is often used. It helps regulate glutamate, a brain chemical that when overactive can damage neurons. In recent years, new treatments have emerged. Anti-amyloid therapies aim to remove amyloid plaques from the brain. These are some of the most promising developments in Alzheimer's research. They don't cure the disease, but they may slow its progression in early stages. Doctors may also treat associated symptoms like depression, anxiety, agitation, because managing emotional and behavioral symptoms is just as important as managing cognitive decline. Non-medical approaches. Medication alone is not enough. In many cases, non-drug approaches are essential. Cognitive stimulation helps keep the brain engaged. Activities like puzzles, conversations, and memory exercises can support function. Reminiscence therapy uses familiar memories, photos, music sense, to reconnect patients with their past. Music therapy is especially powerful. Even in advanced stages, music can trigger emotional responses and moments of clarity. Physical activity improves mood, circulation, and overall brain health. Even gentle movement can make a difference. Causes and risk factors. So, what causes Alzheimer's? There's no single answer. It's a combination of factors. Age, the biggest risk factor. Genetics, certain genes increase susceptibility. Lifestyle factors, including cardiovascular health. Conditions like high blood pressure, diabetes, and smoking can increase risk by affecting blood flow to the brain. There's also growing evidence about sleep quality, social connection, mental stimulation, because brain health is deeply connected to overall health, prevention, and risk reduction. While Alzheimer's cannot always be prevented, there are steps that may reduce risk. Research suggests up to 40 to 45% of cases may be influenced by lifestyle factors. Key actions include regular physical activity, managing blood pressure and cholesterol, avoiding smoking, limiting alcohol, staying socially active, continuing to learn, getting quality sleep, eating a brain-healthy diet. These steps don't guarantee prevention, but they improve overall brain resilience, supporting someone with Alzheimer's. Alzheimer's affects more than the individual. It affects families. Caregiving can be emotionally and physically demanding, but the right approach can make a meaningful difference. Speak calmly and clearly. Use simple language. Be patient. Avoid arguing or correcting. Focus on reassurance. Create a consistent routine. Ensure a safe environment. Encourage independence where possible. Use familiar memories to maintain connection. And most importantly, take care of yourself as a caregiver, because support goes both ways. Alzheimer's is one of the most challenging conditions of our time. It slowly changes memory, identity, and independence. But understanding it changes how we respond. Early awareness, compassion, science, support. These are the tools we have. Because even when memory fades, connection doesn't. Love doesn't. If you found this video helpful, share it with someone who needs it. And remember, no one should face this journey alone.